Hello, my name is Jody Plott, and today my presentation will be over multiple sclerosis. It's also called MS. The first topic will be over what multiple sclerosis is. It's an autoimmune disease in which the body's immune system attacks its own central nervous system. With MS, the immune system attacks and damages or destroys the myelin, which causes an interruption in nerve impulses traveling to and from the brain. MS damages the nerves in the spinal cord and brain as well as the optic nerves. Sclerosis means scarring, and people with MS develop multiple areas of scar tissues in response to the nerve damage. Depending on where that damage occurs, symptoms may include problems with muscle control, problems with balance, vision problems, or speech problems, or some combination of all of these. A very brief history of MS. It has been first described back to the 1300s, but it wasn't until the early 20th century that a unified picture emerged. The first integrative perspective of MS was in 1869 in Paris, and they detailed symptoms of a patient that was in the Paris hospital, and they got all of her symptoms over a period of time, and then when she passed away, they did an autopsy, and in her brain it showed hard nodules, which they called sclerosis or plaques. And then by the time 1950 was here, neurologists considered MS one of the most common neurological diseases in America. So it came a long way fast. Here's a diagram of some of the common symptoms of MS. This is from medicinenet.com. There's visual disturbances and mental changes, depression, muscle spasms and pain, also tingling sensations, loss of sensations, speech impediment, tremors or dizziness, limb weakness, loss of coordination and balance, and bladder and bowel dysfunction. And as far as the pain, on some patients that have MS, they have pain all of the time, and some patients with MS have pain only with flare-ups. And you may or may not have all of these symptoms, but these are the most common ones. In the vision, it can be a partial or a complete loss of vision, and it's usually only in one eye at a time, and there's often pain during eye movement, as well as double vision or blurring of vision. There's oftentimes a lack of coordination or unsteady gait, slurred speech, which I have. Fatigue is one of the common complaints of people with MS, and one of the complaints, fatigue and pain, both cause a lot of interruption in a patient's day-to-day life whenever there's a flare-up. And then a lot of people, once again, with fatigue, a lot of people have fatigue all of the time, not just when a flare-up occurs. And MS symptoms are variable and very unpredictable, and no two people have exactly the same symptoms, and each person's symptoms can change or fluctuate over time. Most of the symptoms can be managed effectively with medication or other treatment strategies. Effective symptom management by the interdisciplinary team of healthcare professionals is one of the key components of comprehensive MS care. How MS attacks. In people with MS, the body's own immune system is attacking the tissue surrounding the nerve fibers in the brain, spinal cord, and optic nerves. And you can look below at the picture, and I'll show a nerve fiber, and it's got the myelin sheath surrounding it. The myelin sheath is that fatty substance that's covering the nerve fiber. and it insulates the nerve and helps them be able to send electrical signals the way they're supposed to be sending them. And when that myelin sheath gets damaged or destroyed, then scar tissue starts forming, and then the nerve messages are not transmitted properly. With the progression of MS, most of the people with MS have a relapsing, remitting course with new symptoms that develop over days or weeks and usually improve partially or completely, followed by a quiet period, which is considered the remission, that can last months or even years. And they use the word relapse when the symptoms come back on, but one of the other terms to use is that a lot of patients tend to refer to as flare-ups. About 60 to 70% of people with relapsing, remitting MS eventually develop a steady progression of symptoms with or without periods of remission, which is secondary progressive MS. The worsening symptoms usually include problems with gait. The rate of progression varies greatly among people with secondary progressive MS. Some people with MS experience a gradual onset and steady progression of signs and symptoms with no relapses, which is primary progressive MS. The cause of MS. According to the National Multiple Sclerosis Society, the cause of MS is still not known. Scientists believe that the interaction of several different factors may be involved, that studies are just continually ongoing in the areas of immunology, epidemiology, and genetics. Scientists also are studying infectious agents that may or may not play a role. In MS, an abnormal immune response attacks the myelin coating around nerve fibers in the central nervous system, as well as the nerve fibers themselves. And ongoing efforts to learn about the immune processes in MS are bringing the scientists closer to understanding the cause of MS. And it discusses environmental factors, and that MS is actually more frequent in areas that are farther from the equator. And the scientists who study disease patterns look at variations in geography, demographics, genetics, infectious causes, and migration patterns in an effort to understand why. Growing evidence suggests that vitamin D plays an important role, and people who live closer to the equator are exposed to greater amounts of sunlight year-round. As a result, they tend to have higher levels of naturally produced vitamin D, which is thought to support the immune function and may help protect against immune-related diseases like MS. The possible relationship between MS and sunlight exposure is currently being looked at in a study in Australia. Infectious factors. Since initial exposure to numerous viruses, bacteria, and other microbes occurs during childhood, and since viruses are well recognized as causes of demyelation and inflammation, it is possible that a virus or other infectious agents are triggering factors for MS. More than a dozen viruses and bacteria, including measles, canine distemper, human herpes virus, Epstein-Barr, and chlamydia pneumonia, have been or are being investigated to determine if they are involved in the development of MS, but none have been definitively proven to trigger MS. And with the genetic factors, MS is not hereditary, But having a first-degree relative, such as a parent or sibling with MS, does significantly increase an individual's risk of developing the disease. Studies show that there is a higher prevalence of certain genes in populations with higher rates of MS. Common genetic factors have also been found in some families where there's more than one person with MS. And some researchers theorize that MS develops because a person is born with that genetic predisposition to react to some environmental agent, that when exposed, it triggers an immune-mediated response. Sophisticated new techniques for identifying genes are helping to answer questions about the role of genes in the development of MS. Understanding what causes MS will speed the process of finding more effective ways to treat and ultimately cure MS, or even prevent it from occurring in the first place. Prognosis. There is no cure for MS. MS is not a fatal disease except in rare cases of severe disease. Most people with MS have normal or near normal lifespans and typically die from the same conditions like heart disease and cancer and pneumonia that affect the general population. Still, MS symptoms can negatively affect the quality of life, and suicide rates among patients with MS are higher than average. The majority of patients with MS do not become severely disabled. 20 years after diagnosis, about 2/3 of people with MS remain ambulatory and do not need a wheelchair, although many of them use a cane or crutches for walking assistance. In regards to diagnosis of MS, there's no specific test to diagnose, but it mainly relies on the doctor ruling out other conditions that might produce similar signs or symptoms. So your doctor will go through a medical history with you and an examination. The doctor may run some blood tests to see if there's any other diseases with symptoms similar to MS. A spinal tap may be done, and in the spinal tap fluid, it may show abnormalities in white blood cells or antibodies that are associated with MS. It also may help rule out viral infections and other conditions with symptoms similar to MS. The MRI is the most definitive way to test for MS because with an MRI, it will reveal areas of lesions on the brain and even the spinal cord. Here's an example of MRI findings in MS, and the one on the left is a healthy brain, and on the right it shows the brain with the damage caused by MS, which are seen there as white, and those are the lesions that are caused by MS. According to WebMD, a specialist called a neurologist is often the MS care team leader. That's because MS is a condition that affects the nervous system. You'll likely need help managing neurological symptoms such as weakness, tremor, and cognitive changes. Other team members may include a nurse, a physical therapist, social worker, occupational therapist, nutritionist, speech-language pathologist, mental health professional, and a urologist, and of course your primary care provider. Multiple sclerosis is estimated to affect 2.3 million people worldwide, and most of those people that are diagnosed between the ages of 20 to 50, although children may have MS as well as elderly. It's 3 times more common in women than in men and is more prevalent among Caucasians than other ethnicities. MS is believed to have a genetic component, as people with a first-degree relative with the disease have a higher incidence than the general population. There's over 400,000 cases in the United States and 2.5 million cases in the world. And so that means in the U.S. alone, about 200 new cases are diagnosed every week. And we kind of touched on this earlier about rates of MS are higher farther from the equator, and that kind of shows you a breakup of the northern versus southern states and how the southern states compare to the northern states. Psychosocial and spiritual implications. I put a quote here that was from Medscape that talked about how MS is an unpredictable and potentially disabling disease, and that it's very difficult to predict the long-term outcomes for a given individual, and that uncertainty represents a big challenge to coping with MS. There's a number of specific psychosocial challenges, including depression, anxiety, sexual dysfunction, cognitive changes, and grief. Depression is the most common psychiatric disorder in MS. There's an increase in suicide risk. They also report more anxiety than healthy controls, with anxiety symptoms associated with the fatigue, sleep disturbance, problem-solving deficits, pain, and disability status, and also a lot of anxiety related to not knowing when a flare-up is going to occur, how they're going to feel day to day, and just the uncertainty of the condition, and is it going to progress, or is it going to kind of maintain steady for a while. Just all of that uncertainty causes a lot of anxiety as well as depression for patients with MS. The cognitive impairments identified in MS are wide-ranging and have included slow processing speed, impairments in verbal and visual memory, various aspects of attention, visual spatial judgment, verbal fluency, and executive function. Cognitive impairments have been found to be highly associated with employment problems, social problems, difficulties in activities of daily living, and quality of life. Another thing related to the depression is the grieving process of patients once diagnosed with MS and dealing with MS. It's the grief related to not being able to have the life that they once had prior to having MS, and not being able to live the life they want to have because of symptoms interfering in the quality of their life. In regards to relationships, the person with MS and their partner need to make sure that they talk about the impact of the disease and how the disease is impacting the relationship, what changes might need to be made in the future. For example, the person with MS may eventually be limited to working from home, or perhaps not working at all, which could put financial strain on the relationship, which would also affect whether the couple is plans to have children or not. That's another thing that would need to be discussed. Just open communication is really important in relationships with any chronic illness. MS can target virtually any part of the nervous system. It can affect the nerves of the reproductive organs, which leads to changes in sexual functioning, slowed arousal time, reduced libido or desire, and altered orgasmic responses are not uncommon experiences. Fatigue also dampens the sexual desire, as well as depression can also decrease the libido. So all of those factors together can cause relationship difficulties as well. In regards to spiritual implication, the literature in a couple of different places discusses about how spirituality is something that is significant in relation to ability to cope with MS symptoms. And in the National MS Society, on their website, they had this quote in there, and I really liked the way this quote was worded. And it talked about that for some it was the more philosophical aspects that provided help. For others, it was the social aspect of regular service attendance, talking about like attending spiritual based organized functions in particular. And for others, it seemed to be a bit of each. This makes sense. When you're faced with a change in your life as significant as MS, you're going to benefit from both social support and the ability to derive meaning from your specific circumstances. This is talking specifically about organized religion or spirituality, but that spirituality in itself does not have to be an organized religious function. And just having spirituality on its own increased patients' ability to cope. That patients that considered themselves spiritual had a higher success rate of the ability to cope with symptoms. Treatment of MS. Treatment typically focuses on speeding recovery from attacks, slowing the progression of the disease, and managing symptoms. Some people have such mild symptoms that no treatment is necessary. Treatments for attacks are corticosteroids such as oral prednisone and IV methylprednisone. These are prescribed to reduce nerve inflammation. Plasma exchange is the liquid part of your blood. It's removed and separated from your blood cells, and then the blood cells are mixed with a protein solution and put back into your body. Plasma exchange may be used if your symptoms are severe and haven't responded to steroids. There's also treatments to modify progression, and there's not any therapies that have been shown to benefit the slowing the progression of primary progressive MS. However, for relapsing remitting MS, certain medications can lower the relapse rate and reduce the rate of formation of new lesions, particularly early in the disease course. And below are some of the medication options, and I'll just let you read through that list. The drugs above, they work by suppressing or altering the activity of the body's immune system. Thus, these therapies are based on the theory that MS is, at least in part, a result of an abnormal response of the body's immune system that causes it to attack the myelin surrounding the nerves. Other treatments of MS are physical therapy, muscle relaxers. They may help for the painful muscle stiffness or muscle spasms. These tend to be often located in the legs. Medications to reduce the fatigue, and then other medications such as antidepressants, pain medication that would help with the bladder or bowel control problems. Those are often associated with MS as well. And this isn't an all-inclusive list, but those are a few of the. Here's some examples of some of the medication that may be used to treat some of the symptoms that we've discussed, such as there's with the Prozac and Zoloft and amitriptyline to treat the depression and so on. The medications aren't necessarily FDA approved for MS, but they help treat the symptoms. Alternative treatments is meditation. It can help MS symptoms such as fatigue, improve quality of life, and reduce pain. It's a mind-body therapy that can help relieve stress, which is common among those with MS. Meditation involves using deep breathing exercises while focusing your mind on a word or phrase that helps you calm down. You can also consider joining a Tai Chi class, which is the ancient Chinese practice that combines slow, flowing movement with meditation and deep breathing and may improve walking ability. There's also acupuncture and different herbal remedies. This is some current news on MS that's related to a blood pressure medication that is appearing to protect against the symptoms of MS in animal models. So this is an interesting study because since it is protecting the myelin and MS destroys the myelin, then if this blood pressure medication works in humans, it's going to be a very big, huge progress in the MS field. There's a link to that article at the bottom of this page. Another recent item in the news regarding MS is about stem cell transplants, that they may actually work better than the existing drug for severe MS. And this was from the American Academy of Neurology. And stem cell transplants may be more effective in treating people with severe cases of MS. And the stem cells that they're talking about here are stem cells taken from bone marrow. And if you want to read more about that, it's at the bottom of the page there. I just added those in because those are both current, like in the last 4 weeks, articles that have come out. And then last but not least, March is MS Awareness Month. And so I thought I would add that to the end of the presentation. Thank you so much. Please refer to your handout for any questions.